Excellent. So we're going to be putting on now a modular external fixation construct for tibia shaft fracture. So this is great for damage control where there's significant soft tissue injury and you want to basically create handles that will allow you to manipulate fracture fragments. And I'll demonstrate how you do that. So what you'll need is, you'll need 2 of the longer chance pins, preferably, and then 2 of the shorter ones. And that will allow you with the longer ones to create your neutralization rod, which I'll also show you in just a moment. You're going to need at least 3 of these smaller rods, and then at least 1 longer one. So the first thing that we're going to do is, oftentimes this is done in damage control where you may not even have access to x-ray. And so again, the safe zone for the tibia is the anterior medial crest. You can feel it on yourself. It's a very subcutaneous border of the tibia, away from tendons, nerves, blood vessels, that sort of thing. So the first thing that we're going to do is we're going to put 2 chance pins in each major fracture fragment, and then create little handles on each one to allow manipulation of the fracture fragments. Now these pins don't need to be parallel. In fact, putting them parallel decreases the pull-out strength. So if you have them at off angles from one another, that actually makes the whole construct much more stable. So what I'll do is I'll start by drilling. So we'll drill the first guy here, again along the intermedial aspect of the tibia. The first chance pin will go in. I'm preferentially using a drill and then non-self-drilling pins to prevent heat necrosis. In limited resource settings, oftentimes we have to leave external fixators on for long periods of time. So if you use a self-drilling pin, it will cause heat necrosis of the near cortex as you're drilling the far cortex with the pin. So if you want your pins to have longevity and to avoid heat necrosis of the near cortex, you use a drill, which just pre-drills your hole and allows you to place your pin much more easily. So that's one pin. And just to avoid repetition here, I'm going to not drill the next one, just because we already have a very nice drill hole readily available for me here. So I'm just going to use that. And in fact, this is an even better angle because you can see it's off angle, and that will increase the pull-out strength of the construct. Again, along the intermedial aspect. It's not quite parallel, that's fine. So again, the concept here with the pins is you want close to the fracture site and far from the fracture site, but you do want them away from the zone of injury preferably. And that zone of injury is demarcated by the soft tissue injury as well as the bony injury. Excellent. Good. These are a little bit too parallel for what I like, but that'll do for the purposes of our demonstration. All right, so now what we're going to do is use 2 of these rods and 4 of these clamps And we're going to create little mini constructs on each of the fracture fragments. What I like to do is have the rod kind of in between here. And that'll provide more surface area to create the construct on either side. Again, we've got soft tissue here, so we're going to just put the pins down, the clamps down a little bit lower, keeping in mind that there is some soft tissue here, so you don't want to be too close. The closer you are, the better in terms of the construct stiffness. And now these can be fully tightened. Keeping enough space here allows management of the soft tissues. If you've got a negative pressure wound therapy dressing, or you're doing wet to dry dressings, whatever you need. You need to take the patient back for additional irrigation and debridement procedures. So now you see that creates a mini frame. And that allows us to manipulate this fracture fragment without grabbing the soft tissues or anything like that. So I'll do the same thing on this one. Again, we'll tighten this down fully to create our fragment-specific mini frame. Okay. And then I'll use my other wrench here just to make sure that everything's fully tight. Excellent. So now we have control of our fracture fragments. So the reduction can be facilitated by using these mini frames as our handles. All right. So the next thing I'm going to do is create our modular construct. Very simply, what that involves is you just put a single connecting rod in between these guys, in between these two frames. What you want is this to just be tight enough that you can still manipulate the fragments. That's only a little bit too much. This will now allow me to manipulate the fracture fragments into position. Still not too tight on this guy. Good. Ali, do you mind again helping me hold this? Thank you very much. Here, you can use the handles.
Can I use this?
Yeah, yeah. Well, I would use those guys. Yeah, exactly. So you can manipulate that until it's in the right place. Yeah, exactly. Perfect. See, now that allows you to manipulate the fracture fragments using these as handles. And then what we'll do is we'll tighten these guys. Good. Excellent. Let me tighten it fully. You happy with the reduction? That's good. Tighten that fully. Don't worry. Damage control, we're just trying to hold things in place to reduce the soft tissue swelling. This isn't definitive treatment. So we tighten that down fully. So that's our provisional reduction. Ellie kind of lost a little bit there. That's not so bad. So that's our preliminary frame. Now the next thing we're going to do is add a second neutralization rod. And this is really important. You cannot rely on a single rod like this, especially in a big patient like that. All right, so now I'm going to add this second neutralization rod once we get our preliminary reduction, okay? And that's, again, just simply adding 2 more clamps and 1 rod. Hold that still for me. It is in the line. Perfect. Then we tighten this clamp down. This one too. Good. And that's our final construct.